Good morning, everyone. Welcome to Pediatric Grand Rounds today. Our speaker will be Dr. Olivia Asamoah. She's one of our third-year residents and current third-year chief residents. Dr. Asamoah graduated from Ross University School of Medicine. She's also completed a Master's of Science in Physiology from Georgetown University and a Master's in Public Health from George Washington University. She will be joining our Tanglewood practice in Gen Peds on graduation. Please join me in welcoming Dr. Olivia Asamoah.
Nice. So today we're going to go over the revised developmental milestones. So some of the objectives are we're going to discuss the importance of screening for developmental delays. We'll review the barriers to screening, the types of screening tools that we commonly use. We'll then talk about the updates to the milestones and then some of the debates surrounding the revisions. So just a little bit of background. So the AAP recommends developmental surveillance and screening to help identify children with any delays or disabilities, to help ensure timely interventions and to help improve outcomes. So I liked this chart because it kind of shows why we do the things that we do. And like I said, we want to help parents recognize what typical development is. A lot of times our first-time parents, or even our not first-time parents, are typically sure what their kids should be doing at each stage. So this is where we come in. We want to talk to parents about what their concerns are for their development. Nobody knows their children better than parents do. So we want to be sure that we have this open dialogue between us and the parents. A lot of times in a lot of literature, a lot of things that are cited as problematic is just building that rapport with our patients. So I think it's really important that we involve parents in the development of their children, having these open conversations. And we also want to support universal screening at the recommended ages and then doing additional screenings when parents have concerns. And so in 2004, the CDC put out the Learn the Signs Act Early program, which they started putting out free developmental milestone checklists. And these included the warning signs for parents, pediatricians, and early childhood professionals. And these milestones were adapted for caring for your baby and young child, birth to age 5, which was the 5th edition, to help it align with our well-child visits. And so similar to other milestone checklists, a lot of the original sources that were used to develop these milestones weren't actually cited on these checklists. And many different types of checklists were developed based on just clinical opinion and not necessarily empirically informed evidence. So essentially, since 2004, there hadn't been any revisions to the milestones at all. So that's kind of what prompted the CDC and the AAP to go ahead and put these out. And so essentially, why is this important? So 1 in 6, or about 17% of children between the ages of 3 and 17 have one or more developmental disabilities. And unfortunately, less than a fifth of these children are actually getting into early intervention before they age out at age 3. And I found this report from fiscal year 2020. So it looked at the number of children who were receiving early intervention in 2020. It looked at all the different counties in Virginia, and there were over 20,000 children enrolled in early intervention in 2020 in Virginia, and this amounted to essentially $30 million that was allocated and used essentially to help these children with the services they were receiving. And like I said before, studies have shown that early identification typically leads to earlier treatment and better outcomes, which is what we're all about. And so I found this table about the benefits of early intervention, and I believe it was one of the papers published in Pediatrics. And so they had it broken down by the different types of outcomes. And so a lot of these things we know, but some of them aren't so common. Obviously, it would improving like parental involvement in their schooling, improving their literacy, higher school completion rates. Obviously, we're getting them the help they need sooner. Reduction in juvenile delinquency, I thought was a pretty interesting one. Less disruptive behavior in the classroom. A lot of times, some of these kids are labeled as having ADHD when, in fact, they actually have a learning disability. So I think that that was something that was really important to point out. It helps improve, their knowledge in nutrition and decreasing their illicit drug use. Overall, in terms of economic outcomes, because we're really big on in the United States. Improved living condition and work skills is important. Decreases in things like teen pregnancy, helping them develop um, social support networks, and obviously improving parent-child relationships and self-respect are always important because we're getting them the help they need sooner. We're kind of helping to foster just better overall skills in general. And so there was a report put out from the CDC back in 2011 that said that 52% of parents stated that they were informally asked about their child's development when they came in for well child visits, and only 21% of those parents actually reported filling out a questionnaire. So showing that we're not doing the greatest job in providing parents with questionnaires when they come in for these visits. And there was a paper that was printed in the Journal of Medicine Pediatrics in 2018, and it looked at a cross-sectional analysis from the Health Services Administration's National Survey of Children's Health. And so they looked at essentially children between the ages of 9 months to 35 months, and there were 9 million children included in the study. And it showed that 30% of the parents or the caregivers stated that they received parent-completed developmental screening surveys when they presented for well child visits. And these are just well child visits, not sick visits. And 37% reported to have received some sort of developmental screening surveillance from their provider in the last year. So again, not the greatest numbers. We are their first line of defense. We're the people who help them get to the services that they need. So showing that there are some barriers to screening. And so I found another paper, and I'm blanking, I think it was the mid to late, like 2000, between like 2010 and 2015, that showed that 82% of primary care physicians had cited ongoing time constraints as the most prominent barrier to screening. They had talked about just the clinical demand and just not being able to do it. Some had said that there were long waits for children to be seen by subspecialists, so unfortunately this led them to not screening like they should have, which is a pretty important thing. You should be screening, even if it's going to take them a while to get into subspecialists. A lack of available specialists for referrals. In some cases, some people don't have access to developmental pediatricians like we do here. A lack of consensus on what the most optimal screening tools are. There isn't a lot of data about what we should be using. We just have the tools that we do use. And one that I thought was pretty interesting was lack of physician confidence in their training and their ability to manage their behavioral and emotional issues, which I think is pretty important. I think that a lot of times this could be a pretty important barrier, but we're a little afraid to admit that we're just not confident like we should be in helping to get these kids the best care. And so I found this article published in Pediatrics back in April 2020, and it was looking at trends in pediatricians and doing developmental screening. And it looked at 2002 to 2016. And so it has them listed for 2002 and 2016, and then I hope you guys can see that okay. The p-values are all the way in the most right-hand column. And so time limitations, as we all know, was a pretty prominent complaint. Lack of the medical staff to actually help them perform screenings. A lot of times, and pretty similar to what we do here, we have the nurses giving them to parents. So if you're having obviously a lack of medical staff, sometimes that can get lost in translation. If they're super busy, they may forget to be handing these forms to parents to fill out. The lack of treatment options, like I said, for positive screening results. Lack of confidence in the ability to screen was shown to be significant as well. And then the few that were not significant were the lack of confidence in the validity of the instruments that we use, lack of knowledge regarding referral options for positive screening results, and then language barriers wasn't significant in the study either. So now we'll just talk about a couple of the formal screening tools, and there are two types. There are the parent completed and then the directly administered. And so the parent completed forms are typically pretty efficient. They're inexpensive. And they engage parents as active participants in their child's health. I think that this is a pretty important one because there are a lot of times when we go into our visits and parents are kind of on their phones the entire time when we're trying to get them engaged and active in the lives of their kiddos. So two of the most extensively evaluated parent-completed forms are the Ages and Stages questionnaire, the ASQ, or the Parents Evaluation of Developmental Status, or the PEDS. And so I wanted to talk a little bit about the PEDS because it's not something that I'm super familiar with, so I figured I would talk about it. It's used to assess infants and children up to 8 years of age. It has a sensitivity of 75% and a specificity of 74%. It is essentially a 10-question questionnaire. There are 8 yes or no questions and then 2 open-ended questions. And it's typically 3 forms, and I'm sorry if it's super small for you guys. So there's the PEDS response form. So this is the form we give to parents. And so the first one is asking about if they have any concerns about their learning, development, or their behavior, and they can just write it in. Then they ask about, do you have any concerns about their speech? Do you have concerns about how you understand what your child is saying? If they're concerns about if they feel like their kids are doing weird things with their hands or their fingers, if they're doing weird things with their arms or their legs, they're trying to get at more gross motor abnormalities. If they have any concerns about their behavior or how they get along with other children, if they have concerns about how they're learning to do things, and then if they're in preschool or their school skills, they could talk about that there. And then the last one is just an open-ended, hey, do you have any other concerns? So then they give these screening tools back to the provider, who then has a score form. And at the top, it has it broken down by ages across. So it goes from essentially infancy to about 7 to 8 years. And then you essentially, by each question, you're looking at either if they're expressing concerns about global cognitive, expressive language delay, receptive, fine gross motor behavior, social, emotional, self-help in school, and you would just go across and score them. And the cool thing about this is that you can keep track of it over time. And then the first, I guess, row going across the bottom, you would count the number of check marks in the fields that are shaded, essentially. And then you would count those up, and then you would use the algorithm. And then that would kind of help you guide you to the next step. And it's broken down into different paths. So if you're concerned about like speech, expressive or receptive language, then you obviously referring them to for hearing screen or for speech therapy, things like that. So not something that I've typically seen used here or when I was in medical school, but it is something that is pretty widely used when I was doing my research. And the ASQ, which I won't go into too much detail about because I think a lot of us are familiar with this. So we're typically at this time using the 3rd edition. So there's 21 age-specific questionnaires from 1 month to 5.5 years old. There are 5 domains: are fine motor, gross motor, got language and communication, problem solving and adaptive behavior, and then personal and social performance. It typically takes longer to complete because there's so many more questions. But it does have a higher sensitivity at 86% and a higher specificity of 85%. And then directly administered is typically based on direct physician observation of the child and is typically a more comprehensive. This is usually something that we are referring kids to have. It's a follow-up to the initial parent-completed screening test, and this is typically done by specialists, so typically by like a developmental pediatrician. And so those are some of the things that we've seen our developmental peds colleagues do, like the KBIT and things like that. So now we're going to go into the article. I put this up here in case anyone hadn't seen that this was published back in Pediatrics in 2022. And it was titled Evidence-Informed Milestones for Developmental Surveillance Tools. And I'm going to give a little bit of background about how they went about doing this before we go through the changes. And so the AAP has essentially a group called the Systems of Services for Children and Youth with Special Health Needs. And this team identified what they called 8 subject matter experts, or SMEs, who were in different fields of child development. So this included developmental and behavioral physicians, neurodevelopmental physicians, and general pediatricians. They also included child and developmental psychologists, and then a professor of special education and early intervention. And these individuals developed 11 criteria for surveillance milestones and tools. And so these were the 11 criteria. The first one is probably the most important of the group. And so they included milestones at the age at which most children would be expected to demonstrate milestones. And I'll talk about a little bit more about that in the next slide as well. But essentially, the current milestones that we have been using is an average. So we would expect 50% of children to demonstrate that milestone. So they went ahead and increased that to 75%. They wanted to eliminate the quote unquote warning signs. They wanted them to be easy for families of different cultural and ethnic backgrounds to observe and actually use, are able to be answered with yes, not yet, or not sure. Using plain language, so I'm trying to avoiding vague terms. And naturally, they're organized in the developmental domains, showing progression of skills when we can. Then milestones are not repeated across checklists. I think a lot of us who have used the checklist have seen that a lot of these milestones are included at different ages, so they try to decrease the number of replicated ones. Including open-ended questions, because it's usually when you get the most information. Including information about promotion and then how to act if there are any concerns. And so they use, like I said, greater than 75% to support just our clinical judgment in terms of how we would provide additional screenings. So the idea was a lot of the times when we use the average as the benchmark, we're using this wait and see approach, like, okay, well, only half of children are expected to do this, such as when we have parents come in and they're complaining about how their kid isn't walking at a year old. Well, we usually tell them, well, there is a range, children are different, let's just wait and see. And we don't typically, we give them between that 12 and 15, 16-month period to start walking. So the idea was to help prevent this just wait and see approach, so that when parents presented with these concerns, we could screen them earlier and hopefully get them to the help they need a little bit sooner. And so these individuals did conduct a literature review, and the articles that they did include in their overall review were those that were written in English. Those were written for children less than 5, because a lot of these checklists only go up to about 5, 5.5. And then they looked for evidence that supported at least one of the individual milestone or something that had consensus milestones. So if it was published clinical opinion, there was a consensus that, hey, most children should exhibit this behavior by this age. The articles that were excluded were if evidence was limited to specific population. So something like our preterm infants, who are typically a little bit behind until they catch up at around age 2. And then articles that were non-peer reviewed or if they were published dissertations. And they also reviewed additional resources. So a lot of us are familiar with the Bright Futures, so they included that. They included some developmental charts from the Speech Language Hearing Association. Again, things from the Ages and Stages or the MCHAT or the modified checklist for autism in toddlers, and then some diagnostic evaluation tools, so different types of scales. And so these were broken down into 4 different categories. So social and emotional, language communication, cognitive, and then motor development. And some of the major changes were that they added more social and emotional milestones. So these were primarily added to see if we could catch those kids who were displaying symptoms of autism a little bit sooner, since a lot of the times parents are typically going to notice some of those social emotional milestones before they may notice some of the language ones later on. They did add 15 and 30-month checklists as well, because this was something that the CDC hadn't provided earlier. So now there were checklists from every age from infancy to 5 years of age. And like I said, they did remove vague language like they may do this or they should begin to do this when they were referring to certain milestones. So now we're going to go through each milestone, so bear with me. I tried to put plus signs next to the ones that were added. These essentially just screenshotted the actual checklist that the CDC published. So from 2 months of age, in terms of social, we know that they should calm down when they're spoken to. They should be looking at your face. They added seems happy when you walk up to her. And let me preface this by saying there is a lot of pronoun usage in the milestones, which is a whole nother topic for another day. But I just want to say that they did use specific pronouns when referring to children, but these are obviously for both sexes. And then smiles when you talk to him or her. They should make sounds other than crying. So trying to get at the cooing kind of sounds. They should react to loud noises. They should watch as you move. And one that they added was that they should look at a toy for several seconds, showing that they can, are focusing essentially. And then in terms of movement, they should be holding up their head when they're laying on their stomach. Should be moving both arms and both legs symmetrically. And then they added open hands briefly. You should see them starting to open their hands a bit more. There we go. So 4 months, at this point, they should be smiling on their own. They added chuckles, but not yet a full laugh when you're trying to make him or her laugh. And they should be looking at you, moving or making sounds to grab your attention at this age. So that was something that they added. Make sounds like ooh, ah, or cooing. They should be doing repetitive sounds, so making sounds back when you're making sounds to them, and then turning toward the sound of your voice. The 2 cognitive milestones that they added were that they should be looking at their hands with interest. This is when they started to notice, hey, I have hands and they do cool things. And if they're hungry, they should be opening their mouth when they see the breast or the bottle, kind of showing that problem solving essentially. In terms of movement or physical development, they didn't add a whole lot for this age group. They should be holding their head steady without support, holding a toy briefly when you put it in their hands, bringing their hands to their mouth, and then pushing up onto their forearms when they're laying on their belly. And I hope I'm not going too fast, but please let me know if I am. For the 6 month, again, they should know familiar people. They like to look at themselves in the mirror, and at this point, they should be full on laughing. They take turns when they're making sounds with you. Blowing raspberries was something that they added, and then making squealing noises. They should be at this age putting things in their mouth because that's how they explore their environment, reaching to grab toys, and then closing their lips to essentially show when they don't want food anymore. And again, the physical developmental milestones didn't change. They should be rolling from front to back, pushing up with straight arms now, instead of just on their forearms, and then leaning on their hands to support themselves when sitting. So sitting supported. The 9-month age group at this point are a little bit showing, stranger danger. They added showing several facial expressions like happy, sad, angry, and surprised. Going back and looking at the data, a lot of parents said that when their kids were later diagnosed with autism, when they thought back, these kids weren't showing a range of facial expressions. So they felt that this was important to add to this age group. Should be looking when you call their name, react when you leave, and then they smile or laugh when you play peekaboo. At this age, they should be making different sounds, lifting their arms to be picked up as a way to communicate, hey, I want to be held by you. They added looking for objects when they're dropped out of sight, like a toy, and then at this point, banging 2 things together. And the movement, getting themselves to a sitting position. They should be moving things from one hand to the other, and at this point, raking food towards themselves. And they moved sitting without support from that 7-ish month range to the 9-month age. So at 12 months, there weren't a whole lot of changes. They should be playing patty cake, waving bye-bye, using mama dada and then another word. An understanding, no, not necessarily following, but they do understand, hey, I should probably pause and look at you when you tell me no. They should be putting things in a container, like a block in a cup, or looking for things that you hide. At 12 months, they did say they should be pulling up to stand and cruising. And then they added drinking from a cup without a lid as you hold it. And then picking things up. So essentially the pincer grasp. So picking things up between the thumb and the pointer finger. So 15 months, they should be copying other children while they're playing and bringing objects to you to show, hey, this is like a really cool thing. Look at this. They should be clapping when they're excited and showing affection. This was another thing that a lot of parents had noticed that their kid wasn't doing at this age, that later when they were diagnosed with autism, they went back retrospectively and said, oh, hey, yeah, my kid wasn't doing this. They should at this age, so they moved the trying to say 1 or 2 words besides mama, dada, like ball for ball or da for dog, to the 15th month from the 12th month. Looking at familiar objects when you start to name them out. They said they should be following directions when you're giving them a gesture and the word. So if you're saying, hey, you put out your hand, and you say, hey, give me the toy, they should understand that, hey, I should give you the toy. And pointing to ask for something or to get help. They should be stacking at least 2 objects like blocks. So this was added to the 15-month age. Taking a few steps on their own and then using fingers to feed themselves food. So at 18 months, the 2 that they added in the social emotional was that they should put out their hands for you to wash them. So if you went to the sink and turned the water on, they should be putting out their hands to kind of model what you're doing, and looking at a few pages in a book with you. Not much added in the language communication. They should be following one-step directions without any gestures at this age and trying to say 3 or more words. They should be copying chores when you're doing them, and playing with toys, and they said like in a simple way, so essentially just pushing a toy car in that kind of motion. They added feeding themselves with their fingers and trying to use a spoon to the 18 months, and at this point they should be able to walk without holding on to anything, and scribbling as well. And then they wanted to point out that this is the time that we should be talking to parents and screening for things like autism. At 24 months, they should be noticing when other children or other people are hurt or upset. So reacting when other people have some sort of emotional reaction, and then looking at your face to see how you react in a new situation. I think a lot of us who have been around children with autism know that that's not something they typically do. So they said that by 2 years of age, this is what they should be doing. They should be using more gestures than just waving and pointing, like nodding yes or blowing a kiss. They should be able to hold something in one hand while they're using the other hand. So they had said like holding a container and taking the lid off. So being able to use both sides of their body to think critically. And at this point, they should be playing with more than one toy at the same time. So knowing that certain things go together, like putting toy food on a plate or brushing their adult's hair, things like that. Nothing added to the movement aspect. Should be kicking a ball, running, walking up a few stairs with or without help. And then they should at this time be able to fully eat with a spoon. And again, this is the time we should be doing autism screenings as well. For 30 months, at this point, they should be showing you things that they can do and then following simple routines. When you're telling them, hey, it's time to clean up, they should be helping you do that. They said they should be saying about 50 words at 30 months. So this was something that was moved up from the 24 months to the 30 months checklist. Saying 2 or more words with one action, like doggy run. They should be able to name things in a book when you point and ask them, and then saying words like I, me, or we. Should at this point be modeling like pretend play. And showing problem solving skills like standing on a stool to reach something, or my niece used to stand on pots to kind of reach things on the counter. They should be able to follow 2-step instructions by 2.5, and then showing that they know at least one color. The only movement milestone that was added was that they jump off the ground with both feet, not just with one, at the 2.5 years. And again, doing general developmental screening at the 2.5-year age. So by 3, they should be able to calm within a few minutes when you leave them. They should, see other kids playing and actually want to join them and not be off playing by themselves. Being able to ask who, what, where, why questions, which is always fun when you're getting questioned by a 3-year-old. Says what action is happening in a picture or book. So if they see someone running or playing or jumping, should be able to talk well enough for others to understand most of what they're saying. Should be drawing a circle at this time and avoiding touching hot objects when you warn them. At this point, they should be able to string items together, like large beads or macaroni, which is one that a lot of parents don't do. So they'll typically say their kids don't do this, but it's more so because they haven't tried to do it. Being able to put on some clothes by themselves, and then being able to use a fork by this age. So bear with me, we're almost there. So in the 4-year age group, they should be able to avoid danger, pretending to be someone else when they're playing. They like to be the helper, so assisting you with household chores, things like that. And then they should be able to self-regulate their own behavior. So they'll act differently when they're in a church versus in a library versus being at home or on a playground. This is when they should be saying 4 or more words in sentences, that they can talk about things that happened at preschool or at school, like, hey, today I did this, and should be able to answer simple questions like, what do you use this for, like a crayon. Cognitively, they should be able to name a few colors, tell you what comes next in a story that they know that you've read a million times, and then at this point, draw a person with 3 or more body parts. And then they added unbuttoning some buttons, and then being able to hold a crayon between their fingers and their thumbs, so not in the fist motion. And lastly, at 5, following rules or taking turns when playing games with other children, singing and dancing. They should be able to help do simple chores at home. Whether they'll do it is another thing, but they should be able to do it. They should be able to answer simple questions. So getting at that reading comprehension, keeping a conversation with more than 3 or 4, like back and forth exchanges, and then using or recognizing simple rhymes. Cognitively, they should be able to count to 10, name some numbers between 1 and 5 when you ask, pay attention for 5 to 10 minutes during activities like a story time, should be able to write some letters in their name and then name some letters when you point to them. At this point, they should be able to button some buttons and then hopping on 1 foot. And I added this because with the CDC checklist, so the first page is the actual checklist, and then the second page is talking to parents about what they can do for each age group. So this was taken from the 5-year checklist. And so to get parents more engaged, it should help them play with toys, putting things together, asking them questions to build up that reading comprehension ability, helping them learn how to do things for themselves. It gives parents examples of what they could be doing, talking to kids about how to regulate their feelings and things like that. So I thought this was pretty cool that they included these on all of the checklists. And so of the final 159 milestones, about 60% were based on the original milestones published by the CDC back in 2004, and about 41% were added when they went through the literature. And more than half of the original 216 milestones were eliminated, and a lot of these were just the ones that were duplicated across different ages. So to make it a little bit more streamlined, they did take some of those off. And so just some sources for debate. Whenever you publish something that is new and different, people will have an opinion. One of the major things I saw when crawling through the research was that they removed crawling as a milestone. So sometimes it's not uncommon for kids to skip that crawling phase. And some people have felt that removing it wasn't helpful in determining certain motor issues. Like you could be able to see if they have a weaker side or if they have any poor strength or poor tone. So this was a really major source of debate when I went through. They also moved certain milestones to later ages. So some people felt that this could lead to later identification. So I got lost in the Facebook world when doing my research for this, and 10 out of 10 would not recommend. So don't do it. But the American Speech, Language, and Hearing Association did release a statement on their Facebook talking about how they felt that there were some inconsistencies and they felt that the CDC should probably talk to speech therapists when they make changes to developmental milestones because they are the ones who are working with these kids. And going back through, it didn't mention anything about utilizing SLPs or OTs when they went through to make these revisions. So probably something in the future to consider is, including the people who actually physically work with these children to ask their opinion when we're making these changes. And another thing that came up in a lot of the mommy groups was if the CDC released these updates, essentially due to the effect of masking. So it's essentially because we have been masking for the last 2 years because of the pandemic, are we trying to essentially cover up that these children are going to be progressing later? And so I did find the CDC did release a brief back in December of last year saying that there wasn't a whole lot of data, but they couldn't necessarily say that there was any clear evidence that face masks interfere with verbal communication. There were a few studies, and I mean a few, maybe a handful, that said, hey, maybe it can interfere with verbal communication and with children's ability to recognize faces and read emotions. But a lot of other studies said that this wasn't necessarily something that we could say is a cause and an effect because kids are so resilient. It was just something that's hard to say. So whether it will have an effect going forward, I think honestly we'll probably just need more time to go through essentially the pandemic and gather more data. But at this time, there's no specific data that says that there's a correlation. And so in terms of some of the limitations, again, at times, looking through the data, there isn't a specific cutoff, and a lot of the times we're just using our clinical opinion and just consensus milestones to represent different behavioral changes that kids should be making. So that's something that they mentioned, hey, this could be a limitation. We're just using anecdotally things that we've seen over time, and we haven't had specific data to say that, hey, kids are doing this by this age. So that is something to think about. There's no certainty that these new milestones will resonate with all families or that they're the most relevant milestones for surveillance. Sometimes a lot of certain things are cultural, like my parents never sat me down and gave me Cheerios to put on a string, probably because they were more worried about me eating the string than the Cheerios. So there's just a lot of things that some parents won't do, and whether that's culturally or just something that their family doesn't do. So there's no way to say that, hey, these are things that everyone does, but it's a way to say, hey, these are things that most kids should be doing. So using that as a benchmark. And then again, the checklists have not actually been tested to determine whether they're actually helpful in leading to better, like more definitive screening, which then gets them into treatment sooner. So we don't necessarily have data to suggest that these new checklists or even the old checklists are actually appropriate in getting our children to the help that they need. So essentially, early identification, like we know, is going to lead to hopefully getting them into the services that they need sooner and helping to improve their outcomes. Again, we do want to help facilitate communication and just building that relationship with the parents so that when they express their concerns, we're taking those concerns seriously and not blowing them off. Again, I think that was a major reason why they changed it from 50% to 75%, so that we weren't doing this wait and see approach, so that parents felt that their concerns were being heard and validated. The checklists are used essentially to prompt conversation so that we're talking about their developmental history, to talk to parents about their concerns, but they're not replacing formal developmental screening. And they can't obviously be used to diagnose developmental delays. These are my references, and I have a few, well, 3 questions. I believe I got these from MedStudy, and again, these are going to be based off of the old milestones and obviously not the new ones. So the first one is the parents of a 2-month-old are concerned that their child may be at risk for autism because her 18-month-old cousin was recently diagnosed. So which of the following most accurately describes an early sign of autism? Lack of make-believe play by 12 months of age, absence of babbling and pointing by 9 months, absence of a social smile by 6 months, not using single words by 10 months of age, or not using 2-word phrases by 18 months. Let's see if I can pull up the chat really quick. You guys have any thoughts? And you guys I can't hear you at Tanglewood, so if you're talking, I can't hear you. I've got a C. David made some hand motions at a C. Okay, looks like a C. Cool. See a lot of C's, and that would be correct. So make believe play, they should be doing this by 18 months, so that's when we would be concerned if they were older and weren't doing this. Absence of babbling and pointing, I believe, is closer to the 13, 14-month range. Not using single words is typically by 15, 16 months, and then they should be using 2-word phrases by 2 or 24 months. The next one is a young boy is able to name 2 colors correctly, describe what to do if hungry, thirsty, or sleepy, and understands the difference between today and not today. He's able to state his age, tell his full name, and form 3-word sentences. By what age are the majority of children able to meet these receptive and expressive milestones? So we've got 18 months, 30 months, 48 months, 24 months, and 36 months. What do you guys think? I see people's hands moving, but I can't see. I got an E. Is that an E, David? Thank you. I appreciate you. Cool. And that is correct. And my last question, during a routine health maintenance examination for a 3-year-old, you complete a developmental assessment. Which of the following findings is most concerning for a delayed milestone? A, walks upstairs with support, placing both feet on each step. Interacts well with other children while playing by sharing and taking turns. Speaks with 75% intelligibility to non-family members. Dresses self without assistance but has difficulty with buttons. And then includes 4 body parts when drawing a person. What do you guys think? I think that's an A and an A from you guys there. I got an A for the hospital team. Yeah, they're so smart. So essentially at this age, they should be able to alternate feet while climbing up the stairs and not placing both feet on each step. So you would be concerned about some gross motor issues. Mastering buttons is about 4 years of age. Cooperative play is about 3 to 4 years. And then being able to name 4 body parts is typically around 4 years of age. So that wouldn't necessarily be a delay. I hope you guys learned something from this. I hope to end a little early in case any guys had any questions, comments, issues. If Tanglewood has issues, I will not be able to hear you. I'm sorry. Question. The word is asking, what is my experience when you identify a child with delay and you want to refer them to a behavioral pediatrician to get them in along with other services such as early intervention, PT, OT? What is the turnaround? The turnaround time I've seen is as far out as 6 to 9 months to get them in with developmental. But so we do try to get them in with services sooner. If we're something that a kid is that we're really concerned about, sometimes I'll just send a personal message to one of our developmental specialists to say, hey, I'm really concerned about this kid. Can we try to work them in sooner? But I've seen a lot of the kids not get in until about six months at least. I feel like you guys are saying something at Tanglewood because your color keeps changing, but again, I can't hear you guys. I'm sorry. Let's see. There's another question. Has the AAP made any commentaries about adopting CDC changes? So the AAP is actually on board. Again, it was the AAP and the CDC together who went ahead and made the changes. So they're on board with the changes. Again, they said they are still going to be reviewing. There's going to be an ongoing review to see if there's anything else that they should add or change, but they are on board with the changes. What's that saying? I think Dr. Ward is saying that it seemed like a long period of time, 6 months. Long, yeah, okay, there we go. It does seem like a long period of time, but having been in developmental clinic, there are a lot of kids who are referred to them. And again, they are, excuse me, a smaller practice, so it's harder for them to get in. I think the unfortunate thing is, at least when I did developmental, there were a lot of these kids who were referred and had to wait 6 months to get in, but then no showed for their appointment. So it's kind of unfortunate because then that's a spot that another kid whose parents would have brought them to the appointment could have gotten. So it does seem like a long period of time, but at least while I've been here, it's kind of just what I've experienced. So I just kind of tell parents, hey, it's going to be this long of a time. I just tell them that ahead of time. Thank you guys. Thank you for the clapping. I appreciate that. Well, if you guys have any other questions, please feel free to find me or email me and I can address those for you guys.